Hi family, welcome back to another episode of the Father's Joy channel, and we bring an amazing topic for today. And again, we have with us an amazing doctor here who took us through our first episode in hypertension, high blood pressure, and his name is Dr. Gilbert Akpene Kabu, a medical officer at the Whole Teaching Hospital. So, Doc, you're welcome again.
Thank you.
The first time you enlightened us about a lot, and today you are here to help us on medical routine or routine medical checkup.
Yeah.
We want to talk about routine medical checkup. So, what is medical checkup?
Thank you very much for having me once again.
Okay.
So, medical checkup simply means going to the hospital, visiting your doctor to ascertain if you are well or unwell. So essentially, just to ascertain the wellness of your entire body. That essentially is what we call routine medical checkup or medical checkup. And if you do it routinely, at least a year, or as it is in some guidelines or policies, doing it every year, then it becomes more of a routine to you.
Okay.
Then it becomes a routine medical checkup.
Okay. So, to really clarify, you're not going there because you're sick.
No.
You're going because you are fit, but you just want to have yourself assessed,
Exactly.
right?
Yes.
Okay. So, why the need for medical checkup?
Good. Very relevant question.
Okay.
So, if you listen to or watched our first episode, you realize that there are a number of people that have certain conditions, hypertension inclusive, and they know nothing about their condition.
Okay.
If you visit the hospital or your doctor because you are not well and then you are sick, that is not a routine checkup. No.
Alright.
You are going there because you have a problem. You're symptomatic of a problem. You have signs that are suggestive
You're not
of
feeling well.
Exactly, you're not well. That is why you are going.
Alright.
Also, if you have an established medical condition for which you visit your doctor routinely, let's say you're hypertensive, so you go to the hospital for your refill of medication to see if you are developing complications or side effects to the medications, then that doesn't fall within routine medical checkup.
Okay.
Yes, so you are going there because though you are well, you just want to see if you are developing any illness for which the symptoms are not manifesting yet. That is what we call a routine checkup.
So just having myself assessed. So as a medical officer, one time you are in a consulting room and I just appeared there. I said, Dr. Cabo, I just came for a routine checkup. I'm not sick. I just appeared that I want to just have myself assessed. And that is routine medical checkup, right?
Yes, exactly.
Okay, so what does it entail, or what do we expect?
All right,
At
so
a routine medical checkup.
if you come for routine medical checkup, just like anybody that visits the hospital, we are going to take your vital signs, which will include your blood pressure, your heart rate, your temperature. We'll also check to see if you are saturating well, that is, your oxygen level is normal.
Okay.
Those are essentially, we'll add your height and then your weight to it, so that we'll be able to obese, overweight, exactly.
Okay.
Because it's very, very important. All these things can predispose you to getting certain conditions for which we do not want. Hence, we'll get all that. Now, after we are done with your vital signs, we'll delve a bit more into asking you maybe a few questions, going into your family to know if there are any conditions that are prevalent in your family. Does anybody in your family, specifically your parents, siblings, do they have hypertension, diabetes, any
Those chronic diseases?
Exactly, dyslipidemia? Do you have any cancers that run in your family? Because there are certain cancers that run in families, though they are specific or a bit more specific to certain sex.
Okay.
Like, let's say breast cancer is more specific to women. That doesn't mean men cannot have breast cancer, but I believe that will be for another day.
Oh, right.
So, do you have any cancers in your family? Would like to prostate for men, dyslipidemia, or do you have high levels of cholesterol? Because it's been known that there are certain families where their cholesterols are usually high. Therefore, we need to have a look at those people. Has anyone suddenly died in your family that was as a result of a heart problem? So all these things are there. They may be in your family that you are not even aware of. Therefore, you need to have yourself checked routinely. So you come, we ask you those questions. If there's a need, we physically examine you, and then we even request for some investigations.
Okay.
Will it be your lipid or your cholesterol level? Will it be your kidneys function? It could be your sugar level, your blood glucose, for us to ascertain, do you have elevated levels in your body? And a few other investigations that may be needed. Would it be an infectious disease we are trying to screen you for? To even an extent. Yes, so if we pick up anything that could suggest that you are depressed, we could even screen you for depression. So all these things are
part of
yes.
So it's very, very necessary.
It's very, very important for everybody to have to be routinely checked up.
So what is the difference from the doctor's visit? What is the difference between this and a normal visit? Maybe you are sick.
Yes, exactly. So you are sick, you are not feeling well. Therefore, you go visit the hospital. You are running temperature. You are coughing. You have chest pain. You have abdominal discomfort. You are vomiting. You are running diarrhea. For those ones, you really need. When you have any of such symptoms, therefore you visit a hospital. That is different. You have a problem, therefore you are visiting a hospital. But you don't have any issue. You are just visiting a doctor to have you checked up for all the things that I mentioned. Then that one is your check up. But then if you have symptoms for which you are reporting to the hospital, that doesn't typically form part of your routine checkup. Yes. That one makes it a doctor's visit because there is a problem. There's fire on the mountain. Therefore, you have
to run.
You have to run.
And get water to quench it.
Exactly.
Get water to quench it. All right. So how often can one have a routine checkup? How often?
Yes. So I made mention of certain conditions that run in families. For instance, breast cancer runs in families. Prostate cancer runs in families. It is known, as I already stated, that the older you get, you can also contract or get certain medical conditions. Therefore, most of the conditions that we have, the cutoff is usually around 40 to 45. So if you age between 40 to 45, it is advised that every single year you have yourself checked up. And in that checkup, you will need to run some investigations, whether it is blood work or it is imaging. For example, if it is for breast cancer, we'll do a mammogram. If it is for prostate, we'll do serum PSA levels, or we do ultrasound. Okay, so how often? Some people are at higher risk for certain conditions, so those people will need to even have it more often. They will need to start early. If you are someone who has a family member that has ever suffered a cervical cancer before, you really need to start screening yourself very early,
so that treatment can begin.
Exactly. If it is picked up, whatever treatment is available, you are given. If it is not picked up, in the European societies, it is known that they vaccinate their young teenagers against conditions which include cervical cancer. Though it is not, yes, it's they are available in Ghana. Actually, the vaccines are available in Ghana for you to pick up and then be vaccinated against. So all those things are a reason
so that
for
will
which
prevent it. It's a preventive measure
to prevent you from getting it. Yes. So in essence, that is typically how we go about having yourself routinely checked. So as to how often, if you're at higher risk, you need to go often. But if your risk is lower and then you are young and the conditions are known to affect those who are elderly, then once a year it's okay to have yourself checked up for those particular conditions. But then having just a general screening or checkup,
so that means
everybody is advised to do so.
Okay, so these checks also includes your eye, your mouth, your ear, every part.
Mostly, if you ever encountered problems in those areas of your or those parts of your body,
Okay.
Yes, if you've ever encountered problems in those parts of your body, then you need to routinely get them checked up. But then when you go to when you visit the doctor, and then during your encounter, the doctor realizes that maybe I should screen your eyes, I should screen your ears, because I'm talking to you and you seem to
Not
have
really.
difficulty hearing me. Then I would then send you to the ENT specialist who assess your ear to know if you have any problem. If I realize that, oh, you told me you can't see from far, then I need to send you to the the ophthalmologist. So it's not everything that we do at the routine checkup. But as I stated, there are some that are generally done. But then within the encounter, if I realize that, oh, you are predisposed or at higher risk of getting certain conditions, then I have to probe into that and then screen you for diseases in those areas as well. Yeah.
Thank you very much. My last question. Recently, there was this video circulating on social media about Apostle Joshua Selman, a Nigerian man of God that we all salute. And he was like, it is very important that Christians has to go for medical checkup. They don't like going for medical checkup. So if you are here as a medical officer, we want to know that sometimes people have this mindset that going for medical checkup means you are not spiritual. You don't believe God for healing. So let me stay at home and get my healing. I don't need to go. And I really have this challenge a lot, especially with our prayer camps. Like sometimes somebody can be having a situation that needs both the spiritual backing and then the medical combination. But they go to camp, the person at the spiritual place, no medication, and they are praying, and sometimes the people, we lose them.
Yeah.
We lose them. So since we are treating this particular topic, what do you have to say with that? Combining our faith with the intellect that God has given you, with how do we move them together?
Great question, concern. We also encounter it at the hospital.
Okay.
In the sense that the person is kept at a camp for so long and finally makes it to our end, and the person is terminal, and there really isn't much that we can do. So you rightly said, God gave us the intellect, God gave us the ability to even study in school. Medicine or science is not against God. Science is not anti-God. It's actually pro-God. It's just uncovering the things that God has already put there. That is what science does. It discovers. So a number of us as medics or medical practitioners believe in God. We are practicing Christians. God has given us the ability to come up with medicines or medications, techniques, interventions to help people. So it is not as though when you come to the hospital, then it means you do not believe in God. For that, I will emphatically say no. It is not true. So there is a portion of the Bible, scripture that says it is not the healthy that needs the doctor. It is actually the sick. And it has been used or propounded that in that sense, God is, or Jesus was actually acknowledging the fact that there will always be the sick, and then there will be a need for the doctor. Okay, exactly. So then also the Bible encourages us that, or the Bible said that wishes above all things that we'll be in good health, even as our soul prospereth. So there are certain things that science has been able to discover through medicine to help us to prolong our lives. We are not taking the place of God, no. Never. It has been proven that if you have high fever or your temperature is high, you take paracetamol, it has a way of acting to bring down the temperature. It has been proven so much that it's accepted. So when you have a high temperature, yes, your faith can help you to bring down the temperature. Nobody is saying do not believe that God can bring down that temperature. But God, through humans or through doctors, through scientists, has given us the opportunity to come up with medications that can also help in that regard. So as you are believing, you can as well take your medication. Okay, so the two go hand in hand. Not that, okay, if by the grace of God your condition is taken away
completely
by faith,
Praise
nobody
God.
is against it. Hallelujah. But then you should also know that whilst you are working on that faith, or your faith to get there, for that condition to disappear, we are also there to help you to control the disease that you have, to prevent it from getting to the point of no return, at least. Okay, so I'll state it again. Science is not anti-God. Science is pro-God. God gives man the ability to discover things, and those things are being used in medicine to help. So we are not saying do not go to the prayer camps, but when you come to the hospital and an advice is given by the doctor, I'll reiterate, please stick to the advice whilst you practice your faith as well.
Thank you so much. Thank you so much. So, yes, there is a God, and science is not anti-God, but it's a pro-God. All right. So, if you are sick, you have to, with that faith or the hospital, you combine both of them to get better.
And then also the routine checkup that you should have it done. You going to the hospital, having yourself checked up doesn't mean you do not believe in God.
Okay.
In fact, whenever the men of God or the women of God organize crusades, what happens is that they always have a medical personnel on the team
to help
to actually confirm to the viewing public or the people who are there that truly you had this, but it is no more there. Because yes, we have been taught to actually detect the pathology or the abnormal. So if we saw you with the abnormal, and then
healing has taken place,
you need to go back to the person who saw the abnormal to be able to confirm that yes, truly you have been made whole. Jesus said, go and show yourself to the elders. I'm sure it's just in a way to confirm, because they had seen the sick man. Okay, so he going back to them to inform them or to show himself to them is just a way of providing evidence. So science is simply evidence-based that yes, truly I've been healed. If you are healed in a camp, you'll be asked to go to the hospital to confirm that truly the thing is yes. It's just the evidence, not that the man of God or the people who have healed you do not believe that you have healed. They just want the evidence behind that. Okay, we saw a pathology, an abnormality. Now we do not see it again, so it is no more there. So
a confirmation. They give us a confirmation. Yeah. And there is this particular I don't know, phrase that I learned it from Dr. Mensa Altabel for a very long time. He said, scientists don't manufacture knowledge, they discover knowledge. It means the thing was there, but it was covered. And so you need to take the cover off and you discover what God has done. And he said that I kind of forget it. So that is it. So thank you so much.
Routine checkup is not anti-God.
It's not anti-God.
Just go for your checkup.
Let's go for checkup, my Christian brothers and sisters. As we pray and we trust God for healing, let's also go for the hospital for them to also confirm and then help us with what is necessary to be done. Dr. Kabu, thank you so much for being here once again. We are grateful for the time. And once again, we encourage you to share, like, comment, subscribe, and leave a comment. If you have a question about your health, you want to link up with the facility through the doctor, you can reach out, you can DM us, send us a message, and we'll find a way to connect back to you. Thank you so much. God bless you, and be in good health even as your soul prospers. God bless you.